today we are going to talk about respiratory acid-based disorders, how to answer in a table viva situation. So, if we talk about the respiratory acid-based disorders, this is actually very common, especially in ICU settings, or in fact in OT settings as well. It is quite common uh, because the patients are on ventilator and because of like poor respiratory ventilator settings, or the patient having some problem like metabolic acidosis, then the patient is trying to compensate, or the patient is getting tachypneic because of pain, so the patient may land up into hypocapnia leading to respiratory alkalosis. So there can be variety of reasons which can lead to respiratory acid-based disorders, and they are very common.